Let's begin by taking 3 slow, peaceful breaths together. Inhale deeply through your nose, feeling your shoulders drop and relax, and exhale gently through your mouth. Once more, breathe in tranquility and breathe out any worries about your skin. One final breath in, feeling present and centered, and breathe out completely. Wonderful. Today we're going to explore rosacea, a common but often misunderstood skin condition that affects millions of people, understanding what causes those persistent flushes and how to care for sensitive, reactive skin. Rosacea is a chronic inflammatory skin condition characterized by facial redness, visible blood vessels, and sometimes bumps that can resemble acne. It typically affects the central face, including your cheeks, nose, forehead, and chin. While rosacea can be frustrating and sometimes affects self-confidence, understanding this condition empowers you to manage it effectively. With proper care and trigger avoidance, most people with rosacea can significantly reduce flare-ups and maintain calmer, more comfortable skin. Let's start by understanding what rosacea actually is. This condition involves dysfunction of your facial blood vessels, leading them to dilate more easily and remain dilated longer than normal. This creates the persistent redness that characterizes rosacea. The exact cause isn't fully understood, but rosacea involves a combination of genetic predisposition, immune system abnormalities, and environmental triggers. It's not caused by poor hygiene, alcohol abuse, or any behavior you should feel embarrassed about. Rosacea is a legitimate medical condition deserving of proper care and treatment. Rosacea has 4 main subtypes, though many people experience features of multiple types. Erythematothelangioectatic rosacea, or ETR, is characterized by persistent facial redness and flushing visible blood vessels called telangiectasias, and often sensitivity and burning sensations. This is the most common subtype. Papulopustular rosacea resembles acne, with red bumps and pus-filled pimples alongside persistent redness. This type is sometimes called acne rosacea, though it's distinctly different from true acne. Epiphymatous rosacea causes skin thickening, most commonly on the nose, creating a bulbous appearance called rhinophyma. This subtype is less common and typically affects men more than women. Ocular rosacea affects the eyes, causing redness, dryness, irritation, and sensitivity to light. Eye symptoms sometimes appear before skin symptoms, and ocular rosacea requires evaluation by an eye doctor to prevent complications. Many people experience features of multiple subtypes, and your rosacea may change over time. Who gets rosacea? This condition typically develops in adults between ages 30 and 50, though it can occur earlier or later. People with fair skin are more prone to rosacea, particularly those of Celtic or Northern European descent, though it occurs in all skin tones. Women develop rosacea more frequently than men, but men often experience more severe symptoms, particularly epiphymatous changes. Having a family history of rosacea increases your risk, suggesting a genetic component. Rosacea is often mistaken for other conditions. The facial redness might be confused with general sensitivity, sun damage, or simply being prone to blushing. The bumps can look like acne, leading to inappropriate treatment with harsh acne products that worsen rosacea. Some people live with rosacea for years before getting an accurate diagnosis, treating it ineffectively because they don't understand what they're dealing with. If you suspect rosacea, seeing a dermatologist for proper diagnosis is valuable. What triggers rosacea flare-ups? Understanding your personal triggers is crucial for managing this condition. Common triggers include temperature extremes, both heat and cold. Hot weather, saunas, hot baths, and even hot beverages can cause flushing. Cold weather and wind can also trigger flares. Sun exposure is one of the most common triggers, with UV radiation causing inflammation and vasodilation. This makes daily sun protection absolutely essential for managing rosacea. Certain foods and beverages trigger rosacea in many people. Spicy foods, hot drinks, alcohol, particularly red wine, and histamine-rich foods like aged cheeses and cured meats are common culprits. However, triggers are individual. You might tolerate foods that cause severe flares in someone else while reacting strongly to something others handle fine. Keeping a symptom and trigger diary helps you identify your specific triggers. Stress and emotions powerfully affect rosacea. Strong emotions, whether positive or negative, can trigger flushing and flares. Chronic stress worsens overall rosacea severity. While you can't eliminate all stress, developing stress management techniques genuinely helps control rosacea. This might include regular exercise, meditation, deep breathing practices, or whatever helps you feel more balanced and calm. Skincare products and routines can trigger or worsen rosacea. Harsh cleansers, alcohol-based toners, physical scrubs, and products with fragrances or essential oils frequently cause problems. Many common skincare ingredients are simply too irritating for rosacea-prone skin. Even products marketed for sensitive skin might contain hidden irritants. Learning which ingredients to avoid is essential for managing rosacea. Certain medications and supplements can trigger rosacea. Vasodilators, medications that widen blood vessels, often worsen flushing. Some blood pressure medications, niacin supplements, and even some topical medications applied to the skin can trigger flares. If you notice rosacea worsening after starting a new medication, discuss this with your prescribing doctor. Don't stop prescribed medications without medical guidance, but awareness of potential connections helps you and your doctor make informed decisions. Now let's discuss how to care for rosacea-prone skin. The foundation is a gentle, minimal routine. Rosacea skin doesn't tolerate complicated multi-step routines with many active ingredients. Simple is better. Focus on cleansing gently, moisturizing adequately, and protecting from the sun. This minimalist approach gives your skin the best chance to calm down and stay calm. Choose cleansers specifically formulated for sensitive skin. Look for cream or lotion cleansers rather than foaming formulas, as foaming agents can be irritating. Avoid cleansers with sodium lauryl sulfate, fragrances, essential oils, or alcohol. Your cleanser should have a neutral or slightly acidic pH and feel gentle, never stripping or tight. Use lukewarm water, not hot or cold, as temperature extremes trigger flushing. Pat your face dry gently with a soft towel rather than rubbing. Moisturizer is crucial for rosacea skin. A compromised skin barrier is common in rosacea, and keeping your skin well hydrated strengthens this barrier. Look for fragrance-free, hypoallergenic moisturizers with barrier-supporting ingredients like ceramides, niacinamide, and fatty acids. Avoid heavy occlusives that might trap heat, and avoid products with potential irritants. Apply moisturizer to slightly damp skin to lock in hydration. Sun protection is non-negotiable for managing rosacea. UV exposure is one of the most consistent triggers across all rosacea sufferers. Use a broad-spectrum sunscreen with at least SPF 30 every single day. Mineral sunscreens with zinc oxide or titanium dioxide are often better tolerated than chemical sunscreens, and they also provide some anti-inflammatory benefits. Apply sunscreen generously.
Skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 millimeters, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 millimeters, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 millimeters, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42. Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50: Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41: Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42: Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43: Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effects on Male Acne, Male-Specific Treatment Approaches, Topical Androgen Treatments. Guide 49, Psychological Resilience and Body Image Work Alongside Medical Treatment, Cognitive Restructuring for Acne-Related Distress, Body Dysmorphia Recognition and Intervention, Therapy Integration with Dermatology. Guide 50, Acne Resolution Success Stories and Lessons Learned, Compilation of Effective Treatment Approaches, Common Successful Patterns, Motivational Insights, Realistic Timelines for Clear Skin Achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47, Drug-Drug Interactions and Safety Considerations with Acne Medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48, Male-Specific Acne Management and Androgen-Driven Considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne.
Welcome, and take a calming breath. Today we're going to demystify something that confuses many people: skincare ingredient lists. Learning to read and understand product labels empowers you to make informed choices about what you put on your skin. Looking at an ingredient list can feel overwhelming. There are long chemical names, unfamiliar terms, and dozens of ingredients in a single product. But with some basic knowledge, you can decode these lists and understand what you're actually applying to your skin. Let's start with how ingredient lists are structured, because this gives you immediate valuable information. In most countries, including the United States, ingredients must be listed in descending order by concentration. The first ingredient is present in the highest amount, the second ingredient is second most abundant, and so on. This continues until you reach concentrations below 1%, at which point ingredients can be listed in any order. This means the first 5 to 7 ingredients typically make up the bulk of the product's formula. These are the ingredients that will have the most impact on how the product performs and how your skin responds to it. Let's look at a hypothetical ingredient list: water, glycerin, cetyaryl alcohol, niacinamide, hyaluronic acid, ceramides, preservatives, fragrance. Water is the first ingredient, meaning this is primarily a water-based product. Water is an extremely common base for skincare products. It's inexpensive, a good solvent for many ingredients, and helps products spread easily. Glycerin is second, which tells you this is a hydrating product. Glycerin is a humectant that attracts moisture to your skin. Cetyaryl alcohol is third. Despite the name alcohol, this is actually a fatty alcohol that acts as an emollient and thickener. It's moisturizing, not drying. Don't confuse fatty alcohols like cetyaryl alcohol with drying alcohols like denatured alcohol or SD alcohol. Niacinamide appearing fourth means it's present in a meaningful concentration. This product will likely provide niacinamide's benefits: calming inflammation, regulating oil, fading dark spots, and strengthening your barrier. You can see how reading even just the first few ingredients tells you a lot about what the product is and what it's designed to do. Now let's discuss categories of ingredients and what to look for. Humectants attract and hold water. These are crucial for hydration. Common humectants include glycerin, hyaluronic acid, sodium hyaluronate, aloe vera, honey, panthenol, provitamin B5, and propylene glycol. If you want a hydrating product, look for humectants high on the ingredient list. Emollients fill in the spaces between skin cells, creating smooth, soft skin and helping repair your barrier. Common emollients include ceramides, cholesterol, fatty acids, squalane, jojoba oil, shea butter, and various plant oils. If your skin is dry, rough, or sensitive, emollients should be prominent in your products. Occlusives create a protective layer on your skin's surface that prevents water loss. Common occlusives include petrolatum, mineral oil, dimethicone, beeswax, and lanolin. Very dry skin benefits from products with occlusives, especially at night. They're the seal that locks in all the hydration and treatment ingredients beneath them. Antioxidants protect your skin from free radical damage caused by UV exposure, pollution, and normal metabolism. Common antioxidants include vitamin C, L-ascorbic acid, ascorbyl palmitate, magnesium ascorbyl phosphate, vitamin E, tocopherol, niacinamide, vitamin B3, green tea extract, resveratrol, and coenzyme Q10. Look for antioxidants in daytime products, especially when your skin faces environmental stressors. Exfoliants help remove dead skin cells and improve texture. We have AHAs like glycolic acid and lactic acid, water-soluble surface exfoliants, BHAs like salicylic acid, oil-soluble, penetrates pores, and enzymes like papain and bromelain, gentle protein dissolvers. Exfoliants typically appear lower on ingredient lists because they're effective at low concentrations, usually between 0.5% and 10%. Retinoids increase cell turnover, boost collagen, and prevent clogged pores. You might see retinol, retinol palmitate, retinaldehyde, or if prescription, tretinoin. These are powerful ingredients that appear effective even at low concentrations. Peptides are chains of amino acids that signal your skin to perform certain functions, often related to collagen production. Look for matrixyl, copper peptides, palmitoyl pentapeptide, and various other peptides. The science on peptides is still evolving, but many people find them helpful for firmness and texture. Now let's talk about ingredients you might want to avoid or be cautious with. Fragrances can cause irritation and allergic reactions. Fragrance is one of the most common causes of contact dermatitis. If you have sensitive skin or are prone to reactions, fragrance-free products are safer. Note that fragrance or parfum on an ingredient list can represent dozens of different chemicals, and companies aren't required to disclose what specific compounds they're using. Natural fragrances from essential oils can also be irritating, despite being natural. Citrus oils, peppermint, eucalyptus, and many others can cause sensitivity. Natural doesn't automatically mean gentle. Drying alcohols like alcohol denat, SD alcohol, and isopropyl alcohol can strip your skin and cause irritation, especially in high concentrations or with prolonged use. However, small amounts in a formula might not be problematic, and they serve purposes like helping products dry quickly or penetrate better. Context and concentration matter. Sulfates like sodium lauryl sulfate, SLS, and sodium laureth sulfate, SLES, are cleansing agents that can be harsh and stripping, especially for dry or sensitive skin. Many people prefer gentler cleansing agents like cocamidopropylbutane or sodium cocoyl, isethionate. Parabens are preservatives that prevent bacterial and fungal growth in products. They've been controversial due to concerns about hormone disruption, though research hasn't definitively proven harm at the concentrations used in cosmetics. If you prefer to avoid them, many products now use alternative preservatives like phenoxyethanol or sodium benzoate. That said, preservatives themselves are important. Products containing water need preservatives to prevent dangerous bacterial and mold growth. Preservative-free products must be packaged carefully in airless pumps and used quickly after opening. Let's discuss concentration. An ingredient appearing on a label doesn't guarantee effectiveness. Concentration matters tremendously. For instance, if vitamin C appears near the end of a long ingredient list, it might be present only in trace amounts for marketing purposes. This is sometimes called fairy dusting, adding trendy ingredients in tiny amounts that won't actually provide benefits just so they can appear on the label. For key active ingredients, you want to see them high enough on the list to indicate meaningful concentrations. If you're buying a niacinamide product, niacinamide should appear within the first 7 ingredients or so, not tucked away at the end. Effective concentrations vary by ingredient. For example, niacinamide is effective at 2 to 5%, vitamin C at 10 to 20%, retinol at 0.25 to 1%, and hyaluronic acid at 0.1 to 2%. You often can't tell exact percentages from ingredient lists, but position gives you a hint. Let's talk about buzzwords and marketing claims because these can be misleading. Clean beauty has no legal definition. What one brand calls clean might differ entirely from another brand's definition. Clean doesn't automatically mean safer or more effective. Judge products by their actual ingredients and how they perform for your skin, not by marketing labels. Natural and organic also aren't automatically better. Some natural ingredients are wonderful for skin. Others can be irritating or ineffective. Some synthetic ingredients are extremely effective and safe. What matters is how an ingredient works for your skin, not whether it came from a plant or a lab. Dermatologist tested sounds impressive, but means very little. It might mean one dermatologist used the product once. It doesn't guarantee effectiveness or safety. Similarly, clinically tested can mean almost anything. The testing might have been minimal or poorly designed. Hypoallergenic suggests a product is less likely to cause allergic reactions, but there's no standard for this term. It's largely marketing. If you have allergies, check the actual ingredient list. Non-comedogenic means less likely to clog pores, but again, there's no standard testing or definition. What clogs pores can be individual. An ingredient that's fine for you might cause breakouts in someone else. Let's discuss how to approach trying new products safely. First, identify your skin's sensitivities. If you know certain ingredients cause reactions, check labels carefully and avoid products containing them. Keep a note in your phone of ingredients you react to so you can reference it when shopping. Second, patch test if you're concerned about reactions. Apply a small amount of the new product to your inner forearm or behind your ear and wait 24 to 48 hours. If no reaction occurs, try it on a small area of your face. If all is well after a few days, proceed with full use. Third, introduce one new product at a time and wait at least a week before adding another. This way, if you have a reaction, you'll know which product caused it. Fourth, remember that expensive doesn't mean better. A drugstore product with good ingredients can work just as well as a luxury product. Judge products by their formulations, not their price tags. Reading reviews can be helpful, but take them with perspective. Skincare is highly individual. A product that's life-changing for one person might break out another person. Reviews can indicate general quality and experience, but your own skin is the ultimate judge. As we close our time together, remember that becoming ingredient savvy is empowering. You don't need to memorize every chemical name or become a cosmetic chemist, but understanding the basics, how to read an ingredient list, what major categories of ingredients do, what to look for, and what to be cautious of, helps you make informed choices. Your skin deserves products that truly serve its needs, not just products with clever marketing. By learning to read labels, you become a more informed consumer and a better advocate for your own skin health. Take a deep breath in and out. You now have the tools to decode ingredient lists and choose products wisely. May you find products that truly benefit your skin. May you feel empowered in your choices. May you trust your growing knowledge and your skin's feedback. Thank you for this time together. Be well and choose wisely. Welcome to this gentle healing space. Take a slow, calming breath. Today we're exploring how to reduce acne marks over time, those stubborn spots that remain after breakouts heal. With patience and gentle care, these marks can fade significantly. Acne marks, also called post-inflammatory hyperpigmentation, or PIH, are dark spots left behind after acne heals. They're not scars. They're areas where inflammation triggered excess melanin production. The good news is that these marks are temporary and will fade on their own, though you can support and accelerate this process. Understanding the difference between marks and scars is important. Acne marks are flat discolorations, brown, red, or purple, depending on your skin tone. Acne scars involve textural changes, indentations, raised areas, or tissue damage. Marks fade with time and proper care. Scars typically require professional treatment. Today we're focusing on marks. The most important step in reducing acne marks is preventing new ones. This means treating active acne gently to minimize inflammation, never picking or squeezing pimples, which increases inflammation and darkening, and protecting your skin from sun exposure, which darkens marks significantly. Sun protection is absolutely crucial for fading acne marks. UV exposure triggers melanin production, making marks darker and slowing fading dramatically. Wear broad-spectrum SPF 30 or higher every single day, even when indoors or when it's cloudy. Reapply if you're outside for extended periods. Without consistent sun protection, other treatments will be far less effective. Now let's discuss treatments that support mark fading. Several ingredients have been proven to help fade hyperpigmentation safely and effectively. Vitamin C is a powerful antioxidant that inhibits melanin production and brightens skin. Use a serum with 10–20% 𝒆𝒐𝒗𝒊𝒏𝒈 acid, the most effective form. Apply it in the morning under moisturizer and sunscreen for antioxidant protection throughout the day. Be patient. Vitamin C takes several weeks to show visible results. Niacinamide reduces inflammation, which prevents marks from forming and helps fade existing marks by inhibiting melanin transfer. A serum or moisturizer with 5 to 10% niacinamide can be used twice daily and works well with other ingredients. Alpha hydroxy acids like glycolic or lactic acid exfoliate surface layers, encouraging cell turnover that gradually removes pigmented cells. Start with 5 to 8% concentration 2 or 3 times weekly. As your skin builds tolerance, you can increase frequency. Always use AHAs in the evening and be diligent with sun protection the next day. Azelaic acid addresses both active acne and marks simultaneously. It has antibacterial properties and inhibits melanin production. A treatment with 10 to 20% azelaic acid can be used once or twice daily. Retinoids accelerate cell turnover, bringing fresher, less pigmented cells to the surface while preventing new pigmentation. Over-the-counter adapalene or prescription tretinoin used consistently over months significantly fades marks. Start slowly, 2 to 3 times weekly, and build tolerance. Always use retinoids at night with thorough sun protection the next day. Kojic acid, licorice root extract, and arbutin are natural ingredients that inhibit melanin production. Look for serums containing these ingredients. They're gentle and can be used daily. Tranexamic acid is a newer ingredient showing promise for fading hyperpigmentation. Products with 2 to 5% tranexamic acid can be incorporated into your routine. Layer these ingredients thoughtfully. A common effective routine: morning, vitamin C serum, niacinamide moisturizer, sunscreen; evening, cleanser, AHA or retinoid, niacinamide moisturizer. Don't use all actives at once. Choose 2 to 3 that work for your skin and use them consistently. Rotation works well. AHA one night, retinoid the next. Rest day, repeat. Be patient. Acne marks take time to fade. Typically 3 to 6 months for significant improvement, sometimes up to a year for complete fading. Consistency matters more than intensity. Gentle, regular use of effective ingredients will fade marks over time. Professional treatments can accelerate fading if home care isn't sufficient. Chemical peels performed by professionals provide deeper exfoliation. Microneedling stimulates collagen production and can help fade marks. Laser treatments target pigmentation specifically, but can be expensive and require downtime. Discuss these options with a dermatologist if you're interested. Professional treatments combined with good home care give the best results. Lifestyle factors affect mark fading. Manage inflammation by reducing stress, getting adequate sleep, eating anti-inflammatory foods, and staying hydrated. Less inflammation during healing means less dark marking. Be extremely gentle with active breakouts. Never pick or squeeze. This dramatically increases inflammation and resultant dark marks. If a pimple needs draining, use clean tools, minimal pressure, and immediately apply spot treatment. Keep your skin well moisturized. Healthy, hydrated skin repairs and renews itself more effectively than dry, compromised skin. Certain skin tones are more prone to post-inflammatory hyperpigmentation, particularly darker skin tones with more melanin. If you have darker skin, be especially vigilant about sun protection and gentle acne treatment. The principles are the same, but the importance is amplified. Avoid harsh treatments that could cause more inflammation and thus more marks. Be cautious with strong peels, aggressive exfoliation, or irritating ingredients. Gentle, consistent care works better than aggressive treatment for fading marks. Understand that complete fading takes time measured in months, not days or weeks. Set realistic expectations. Significant lightening in 3 to 6 months is success. Don't expect miraculous overnight results. They don't exist. Take photos monthly to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual fading occurring. Stay consistent even when progress feels slow. The treatments work cumulatively. Every day of gentle care, sun protection, and appropriate treatments is contributing to fading, even when you can't see immediate results. As we close, remember, acne marks are temporary. With patience, protection, and gentle encouragement through effective ingredients, they will fade. Your skin knows how to heal and renew itself. Support it consistently and trust the process. May your marks fade gently and completely. May you have patience for the healing timeline. May your skin become clear and even. Thank you for this time together. Trust the fading process. Welcome to this caring moment. Breathe deeply, feeling your body relax. Today we discuss caring for your skin after pimple extraction, how to support healing and prevent scarring after a blemish has been drained. Sometimes, despite our best intentions not to touch breakouts, a pimple comes to a head and needs to be drained, or you've had professional extraction. Proper aftercare is crucial for healing without infection, inflammation, or scarring. First, understand what happens when a pimple is extracted. Whether open naturally or manually, extraction creates a small wound. The protective skin barrier is breached, leaving the area vulnerable to infection and inflammation. Your immediate care in the hours and days following extraction significantly affects healing outcomes. Immediately after extraction, the priority is cleanliness and protection. If you've just extracted a pimple at home, immediately cleanse your hands and the affected area with gentle cleanser and lukewarm water. Pat dry very gently with a clean towel or tissue. Apply an antibacterial spot treatment. Benzoyl peroxide at 2.5% kills bacteria that could infect the open pore. Alternatively, use a spot treatment with salicylic acid or a dab of antibiotic ointment. Apply carefully just to the extracted area. Consider applying a hydrocolloid bandage or acne patch over the extracted pimple. These serve multiple purposes. They protect the wound from touching and bacteria, absorb any remaining fluid, create a moist, healing environment that reduces scarring risk, and prevent you from touching the area again. Leave the hydrocolloid patch on for several hours or overnight. When you remove it, you'll often see that it's absorbed additional fluid, continuing the clearing process. For the first 24 to 48 hours after extraction, be extremely gentle with the area. Don't apply makeup over it if possible. Don't touch it. Don't pick at any scab that forms. Scabs are your skin's natural bandage, and removing them increases scarring risk. Cleanse your face gently once daily, being extra careful around the extracted area. Use your regular gentle cleanser with fingertips only. Pat dry carefully. Continue applying spot treatment and/or hydrocolloid patches until the area has closed and begun healing. This typically takes 2 to 5 days depending on the size and depth of the original pimple. Once the wound has closed, usually after a few days, you can begin supporting healing and preventing scarring. Keep the area well moisturized. Hydrated skin heals better and faster than dry skin. Apply your regular moisturizer over the healing area. Protect the area from sun exposure vigilantly. UV radiation can darken healing skin, creating post-inflammatory hyperpigmentation that lasts for months. Apply sunscreen carefully over the area every day. Consider using a zinc oxide-based spot treatment that provides both sun protection and healing support. After a week or so, when the area has healed over but may still be red or dark, you can begin using ingredients that support scar prevention and fade any darkening. Vitamin C serum helps brighten post-inflammatory marks and supports collagen production. Apply carefully to the healing area once or twice daily. Niacinamide reduces inflammation and helps prevent excess pigmentation. A serum or moisturizer with 5% niacinamide can be applied to the healing area twice daily. Once the area is fully healed with intact skin, usually after 1 to 2 weeks, you can carefully use gentle exfoliants to help fade any remaining mark. AHAs like glycolic acid at 5 to 8% concentration used 2 to 3 times weekly help remove pigmented surface cells. Retinoids support cell turnover and collagen production, helping heal marks faster. Wait until the area is completely healed before applying retinoids, then use them carefully 2 to 4 times weekly. What not to do after extraction. Don't pick at scabs or peeling skin. This dramatically increases scarring risk and can reintroduce infection. Don't apply harsh treatments hoping to speed healing. Aggressive products cause more inflammation and delay healing. Don't cover with heavy, pore-clogging makeup immediately. If you must cover it, use light, non-comedogenic mineral makeup and remove it thoroughly in the evening. Don't expose healing skin to sun without protection. This causes darkening that can last for months. Don't extract the same area again. Welcome and breathe deeply. Today we're expanding our focus beyond facial skincare to embrace your entire body. Your skin is one continuous organ deserving of care from head to toe. Most people spend considerable time and money on facial skincare while largely neglecting the skin on their bodies. But body skin faces many of the same challenges as facial skin: dryness, sun damage, aging, irritation, and deserves attention too. Your body skin is generally thicker and more resilient than facial skin, but it still needs moisture, protection, and care. Let's explore how to care for your body effectively without making it complicated or time-consuming. Let's start with cleansing your body. The way you shower or bathe significantly affects your skin. Hot water feels wonderful but strips your skin's natural oils, leading to dryness and irritation. Use lukewarm or warm water instead of hot. Your skin will thank you. Keep showers relatively brief. 10 minutes is adequate for cleansing without excessive drying. Long, hot showers are relaxing but dehydrating for your skin. Choose gentle body cleansers rather than harsh soaps. Many traditional bar soaps have a high pH that disrupts your skin's natural acid mantle. Look for soap-free cleansers, gentle body washes, or pH-balanced soaps. You don't need to vigorously scrub your entire body every day. Gentle cleansing with your hands or a soft washcloth is sufficient. Focus cleansing on areas that produce more oil and sweat: underarms, groin, feet. Other areas might only need water or very gentle cleansing most days. If you enjoy using a loofah or body brush, choose soft ones and replace them regularly as they harbor bacteria. Use gentle pressure. You're cleansing skin, not scrubbing a floor. Rinse thoroughly. Soap residue left on skin can cause irritation and dryness. Pat dry with a towel rather than rubbing vigorously. Leave your skin slightly damp. This is the perfect time to apply body lotion. Now let's talk about moisturizing your body, which is perhaps the most important step in body skincare. Immediately after showering, while your skin is still slightly damp, apply body lotion or cream. Damp skin absorbs moisturizer better, and the lotion helps seal in that moisture. Choose a body moisturizer appropriate for your skin type and needs. If you have very dry skin, look for rich body creams or body butters with ingredients like shea butter, cocoa butter, or thick oils. If you have normal to oily skin, lighter body lotions work well. If you have sensitive skin, choose fragrance-free, minimal ingredient formulas. Good body moisturizers contain humectants like glycerin or hyaluronic acid that draw moisture in, emollients like plant oils that smooth and soften, and occlusives like dimethicone or petrolatum that seal moisture in. Apply generously. Don't skimp on body lotion. Your body has a lot of surface area and needs adequate product. Use long, smooth strokes to apply, massaging it in gently. Pay special attention to areas prone to dryness: elbows, knees, hands, feet, and lower legs. These areas have fewer oil glands and tend to be drier. Make this a daily habit. Your body doesn't need moisturizer just in winter. It benefits from daily moisture year-round. If you have very dry skin or specific problem areas, you might consider different products for different needs. A rich cream for feet, a lighter lotion for your torso and arms, perhaps a specialized treatment for rough elbows or keratosis pilaris. Let's discuss exfoliation for body skin. Body skin benefits from regular exfoliation just like facial skin. This removes dead cells, prevents clogged pores, improves texture, and helps your moisturizer absorb better. Physical exfoliation with body scrubs can be more vigorous than facial exfoliation, since body skin is generally more resilient. Use body scrubs once or twice weekly in the shower. Choose scrubs with fine particles. Salt or sugar scrubs work well. Apply to damp skin, massage in circular motions, then rinse and follow with moisturizer. Dry brushing before showering is another exfoliation option. Using a natural bristle brush on dry skin, brush in long strokes toward your heart. This exfoliates, stimulates circulation, and may support lymphatic drainage. Follow with your shower and moisturizer. Chemical exfoliation for body skin can be very effective. Body lotions containing AHAs like lactic acid or glycolic acid help with rough texture, bumps, and keratosis pilaris, those small bumps on upper arms and thighs. Use these consistently for several weeks to see results. For feet specifically, you might need more intensive exfoliation. Pumice stones used on damp feet gently remove thick, dead skin on heels and soles. Be patient and gentle. Don't try to remove all thickness in one session. Now let's address sun protection for body skin. Just like your face, your body skin needs sun protection. Sun damage causes premature aging, dark spots, and increases skin cancer risk. Apply broad-spectrum SPF 30 or higher to all exposed body skin before going outside. This includes arms, legs, chest, back, hands, any area not covered by clothing. Reapply every 2 hours when outdoors, or more frequently if swimming or sweating. Clothing provides sun protection too. Tightly woven fabrics offer better protection than loosely woven ones. Some clothing is specifically rated for UV protection. Don't forget commonly missed areas: tops of feet, backs of hands, back of neck, ears. These areas get significant sun exposure and are prone to sun damage. If you spend lots of time outdoors, invest in proper sun protection. The money spent on sunscreen is far less than the cost of treating sun damage later. Let's talk about specific body skin concerns. Keratosis pilaris, those small, rough bumps on upper arms, thighs, or buttocks, is very common and harmless. It's caused by keratin buildup in hair follicles. Regular exfoliation with AHA lotions helps smooth the bumps. Be patient. Improvement takes weeks to months of consistent use. Moisturizing helps too. Don't pick or scratch the bumps. Body acne, particularly on back and chest, can be addressed similarly to facial acne. Use a gentle cleanser with salicylic acid. Wear loose, breathable clothing. Shower promptly after sweating. Use body lotions with acne-fighting ingredients. Change sheets regularly. If severe, see a dermatologist. Stretch marks are scars that form when skin stretches rapidly during growth spurts, pregnancy, or significant weight changes. They're permanent once formed, though they fade from red purple to white silver over time. No cream can eliminate existing stretch marks, though keeping skin well moisturized during periods of rapid stretching might help prevent severity. Prescription tretinoin might modestly improve appearance of newer stretch marks. Laser treatments can help with mature stretch marks, but won't eliminate them completely. Ingrown hairs occur when hair grows back into the skin instead of up and out. Exfoliation helps prevent them by removing dead skin cells that trap hair. Moisturize to keep skin supple. Don't pick at ingrown hairs. This can cause scarring and infection. If problematic, consider alternative hair removal methods or see a dermatologist. Dry, cracked heels need intensive care. Exfoliate with a pumice stone regularly. Apply thick, urea-based creams specifically for feet. Consider overnight treatments. Apply thick cream, then wear cotton socks to bed. Be patient and consistent. Let's discuss hand care specifically, since hands are constantly exposed and washed frequently. Your hands age faster than most body parts due to constant sun exposure, frequent washing, and exposure to harsh chemicals and environmental stressors. Wash hands when needed, but avoid excessive washing with harsh soaps. Use gentle, moisturizing hand soap. Apply hand cream after every hand washing. Keep hand cream by every sink, in your bag, at your desk. Make reapplication a habit. Use hand cream with SPF during the day or apply sunscreen to hands. Sun damage on hands is very visible. Age spots, thin skin, prominent veins. Wear gloves when doing dishes or cleaning to protect hands from harsh chemicals and hot water. Get manicures if you enjoy them, but ensure the salon is clean and follows proper hygiene. Don't cut cuticles. Push them back gently instead. As we approach the end of our time together, remember that body skincare doesn't need to be complicated. The essentials are simple. Gentle cleansing with lukewarm water, immediate moisturizing after bathing while skin is damp, regular exfoliation once or twice weekly, and sun protection on exposed skin. Consistency matters more than perfection. Daily moisturizing, even with an inexpensive but effective body lotion, produces better results than occasionally using an expensive product. Your body carries you through life, works tirelessly for you, and deserves care and appreciation. Taking a few minutes daily to moisturize isn't vanity. It's basic self-care and respect for the body that serves you so well. Soft, comfortable body skin feels good. It doesn't itch or feel tight. It's more resilient and healthy. These aren't just aesthetic benefits. They're comfort and health benefits that improve your daily quality of life. Find products you enjoy using, pleasant scents, textures you like, application that feels good. These make you more likely to maintain your routine. Body care should be a pleasure, not a chore. Take a deep breath in and out. You now understand the foundations of body skincare. May your skin be soft, comfortable, and well cared for from head to toe. May you treat your entire body with the kindness and attention it deserves. May you feel comfortable and confident in your skin. Thank you for this time together. Care for your whole self. Moisturize with consistency and appreciate the body that carries you through life. Hello and welcome to this peaceful moment just for you. Take a deep breath in and gently release it. This is your time to learn about caring for your skin in the most gentle, loving way possible. Today we're going to talk about the beautiful basics of skincare, the foundation of healthy, balanced skin. There's no rush, no pressure, just calm guidance as we explore together how to nurture the skin you're in. Your skin is remarkable. It's your body's largest organ, and it works tirelessly every single day to protect you. It deserves kindness, patience, and understanding. And the wonderful news is that caring for your skin doesn't have to be complicated, expensive, or stressful. In fact, the most effective skincare is often the simplest. Let's begin with a fundamental truth. Healthy skin is balanced skin. When we talk about balance, we mean skin that isn't too oily or too dry, skin that feels comfortable, and skin that can protect itself effectively. Your skin has a natural rhythm, a natural state of equilibrium it's always trying to maintain. Our job isn't to fight against it or force it to be something it's not. Our job is simply to support it. The first step in supporting your skin is understanding that less is often more. In a world filled with hundreds of products and endless advice, it's easy to feel overwhelmed. You might wonder if you need 10 different serums, 3 types of acids, or the latest trending ingredient. The truth? You probably don't. What your skin truly needs is consistency, gentleness, and a few well-chosen basics. Let's talk about those basics now, slowly and mindfully. The foundation of any skincare routine is cleansing. Cleansing isn't about scrubbing away or stripping your skin. It's about gently removing the dirt, the oil, the environmental particles that have settled on your skin's surface. Think of cleansing as a soft reset button. You want a cleanser that leaves your skin feeling clean but not tight, fresh but not stripped. If your skin feels squeaky clean after washing, that's actually a sign you may be over-cleansing. Healthy cleansing leaves your skin feeling soft and comfortable. Choose a gentle, pH-balanced cleanser. Your skin's natural pH is slightly acidic, around 4.5 to 5.5. When you use harsh soaps or cleansers, you disrupt this balance, which can lead to irritation, dryness, or even increased oil production as your skin tries to compensate. A gentle cleanser respects your skin's natural state. After cleansing, we move to moisturizing. Moisturizing is perhaps the most important step in your skincare routine, regardless of your skin type. Yes, even if you have oily skin. Moisture is different from oil. Moisture is water, hydration. It's what keeps your skin cells plump, healthy, and functioning properly. When your skin is well hydrated, it looks clearer, feels softer, and can better protect itself from irritation and environmental stress. A good moisturizer does 2 things. It delivers hydration to your skin, and it helps seal that hydration in. Think of it as both a drink of water for your skin and a protective barrier to prevent that water from evaporating away. You don't need anything fancy, just something that feels comfortable on your skin and doesn't cause irritation. Now, let's talk about the one non-negotiable in skincare: sun protection. Sunscreen is the single most important anti-aging skin-protecting product you can use. The sun's ultraviolet rays damage your skin on a cellular level every single day, even when it's cloudy, even when you're indoors near windows. This damage accumulates over time, leading to premature aging, dark spots, and increased risk of skin concerns. But here's the gentle truth. Sun protection doesn't have to be complicated. Find a sunscreen you genuinely like wearing, one that feels good on your skin, doesn't irritate your eyes, and that you'll actually use every single day. That's the best sunscreen for you. Apply it every morning, and if you're spending extended time outdoors, reapply every 2 hours. It's a simple habit that will serve your skin for a lifetime. These 3 steps, gentle cleansing, thoughtful moisturizing, and daily sun protection, form the core of healthy skincare. Everything else is supplementary. You don't need a dozen products. You need these basics, done consistently, with patience and care. But skincare isn't just about what you put on your skin. It's also deeply connected to how you live your life. Your skin reflects your overall health and well-being. When you're stressed, not sleeping well, or not drinking enough water, your skin often shows it. This isn't something to feel guilty about. It's simply your body's way of communicating with you. Let's talk about hydration from within. Drinking water throughout the day supports every cell in your body, including your skin cells. When you're well hydrated internally, your skin can maintain its moisture balance more easily. You don't need to force yourself to drink excessive amounts. Just sip water regularly throughout the day and notice how your skin responds over time. Sleep is another beautiful gift you can give your skin. While you sleep, your skin enters repair mode. It regenerates cells, produces collagen, and heals from the day's stresses. When you consistently get quality sleep, your skin has the time and resources it needs to maintain itself. 7 to 9 hours is ideal for most people, but listen to your body and honor what it needs. Stress affects your skin in profound ways. When you're stressed, your body produces cortisol, a hormone that can increase oil production, trigger inflammation, and impair your skin's healing ability. Finding ways to manage stress, whether through deep breathing, gentle movement, time in nature, or simply allowing yourself moments of rest, is truly a form of skincare. Your diet matters too, though not in the extreme ways you might have heard. You don't need a perfect diet to have healthy skin, but generally eating a variety of whole foods, including fruits, vegetables, healthy fats, and adequate protein, gives your skin the nutrients it needs to thrive. Foods rich in antioxidants, like berries, leafy greens, and nuts, are particularly supportive of skin health. Now, let's address something important: patience. Healthy skin is not achieved overnight. It's not created by a single magical product or a dramatic routine overhaul. Healthy skin is built gradually through consistent, gentle care over weeks and months. Your skin cells naturally renew themselves approximately every 28 days. This means that any changes you make to your routine won't show full results until at least a month has passed, and often longer. This is why consistency matters so much more than perfection. It's better to use a simple, gentle routine every single day than to have a complex routine you only follow sporadically. Build habits that you can sustain. Choose products that you genuinely enjoy using. Make skincare a moment of self-care rather than a chore. As you develop your skincare practice, pay attention to your skin's signals. Healthy skin should feel comfortable. It shouldn't burn, sting, or feel excessively tight. A little tingling from certain active ingredients is normal, but pain or intense discomfort is always your skin's way of saying, "This is too much." Honor those signals. Pull back when needed. Your skin will tell you what it needs if you listen gently. Remember that your skin will change throughout your life. Hormones, seasons, stress levels, and aging all affect how your skin behaves. What works perfectly in your 20s might need adjustment in your 30s or 40s. This isn't failure. It's simply your skin evolving and your skincare practice evolving along with it. Stay curious and willing to adapt. One more essential truth: comparison is the enemy of skin health. Your skin is unique to you. It has its own texture, its own tone, its own patterns and behaviors. Comparing your skin to edited images on social media or to your friend's skin will only create unnecessary stress and dissatisfaction. Your skin at its healthiest is simply your skin, not someone else's ideal. As we come to the end of our time together today, let's return to where we began. Simplicity, consistency, and gentleness. These are the three pillars of healthy, balanced skin. Simplicity means choosing a few effective products rather than overwhelming your skin with too much. Consistency means showing up for your skin every day, even when you're tired, even when you don't feel like it. Gentleness means treating your skin and yourself with patience, kindness, and respect. You now have the foundation. You understand the basics. Trust this knowledge. Trust your skin, and trust that with time, gentle care, and patience, you can support your skin in being the healthiest version of itself. Take one more deep breath in and release. You're doing beautifully. Thank you for spending this peaceful time learning about caring for your skin. May your skincare journey be gentle, joyful, and kind. Hello, and welcome to this peaceful moment. Let's take a deep breath together. Breathe in slowly, filling yourself with calm, and breathe out gently, releasing any tension. Today, we're going to explore a philosophy that can transform not just your skincare routine, but your entire relationship with your skin, the beautiful concept of skin minimalism. Minimalism isn't about deprivation. It's about intentionality. It's about choosing quality over quantity, purpose over impulse, and effectiveness over excess. In skincare, minimalism means using fewer products more thoughtfully, trusting your skin's natural wisdom, and finding freedom in simplicity rather than overwhelm in abundance. We live in an age of excess. The beauty industry produces thousands of new products every year, each promising to solve a problem you might not have even known existed. 10-step routines are normalized. Bathroom shelves overflow with half-used bottles. Social media influencers showcase elaborate routines with countless products. The message is constant and loud. You need more, more, more. But here's a radical truth. Less is often more. Your skin doesn't need 20 products. It needs the right products, used consistently with patience and respect for its natural processes. Skin minimalism is about stripping away the unnecessary to reveal what truly matters. Let's talk about why minimalism works so well for skin health. First, simplicity reduces the risk of irritation and sensitization. Every product you apply is a potential source of irritation. Every ingredient could trigger a reaction. The more you use, the higher the risk. By using fewer products, you significantly decrease the chances of overwhelming or irritating your skin. Minimalism also allows you to truly understand your skin. When you're using 15 products, how do you know which one is helping and which one is causing problems? When you're using 3 or 4 carefully chosen products, you can clearly see what's working. You develop genuine knowledge of your skin's needs and responses. There's also the practical beauty of minimalism. Fewer products mean less time spent on your routine, which makes consistency easier. They mean less money spent, which makes quality choices more affordable. They mean less clutter in your space, which creates a sense of calm. And they mean less environmental impact from packaging and waste. But perhaps most importantly, minimalism shifts your focus from fixing to maintaining. Instead of constantly trying to correct perceived flaws with new products, you're supporting your skin's natural health. This is a gentler, more sustainable approach that honors what your skin already does beautifully on its own. So what does a minimalist skincare routine look like? At its core, it includes only the essentials: a gentle cleanser, a good moisturizer, and broad-spectrum sunscreen. These 3 products address the fundamental needs of all skin types. They cleanse without stripping, hydrate without overwhelming, and protect against the primary cause of skin damage. For some people, these 3 products are enough. If your skin is healthy and you have no specific concerns, there's absolutely no reason to add more. Healthy skin maintained with consistent basics is a worthy goal, perhaps the worthiest goal of all. For others, a minimalist routine might include 1 or 2 additional targeted treatments, perhaps a gentle retinol serum for anti-aging, or a niacinamide serum for pore refinement, or a hydrating essence for extra moisture. But here's the key. These additions are purposeful, not impulsive. You're adding them because your skin genuinely needs them, not because marketing told you to. Let's talk about how to transition to a minimalist routine if you're currently using many products. The process requires patience and observation, but it's deeply rewarding. Start by removing everything from your routine except the absolute basics: cleanser, moisturizer, and sunscreen. Yes, everything else. The serums, the essences, the toners, the masks, the spot treatments. Set them aside for now. Use only the basics for 2 to 4 weeks. This might feel scary. You might worry your skin will suddenly develop problems without all those products. But often, the opposite happens. Your skin, relieved of the burden of processing multiple products, begins to calm down. Irritation subsides. Congestion clears. Your natural skin texture and tone emerge. During this period, observe your skin carefully. How does it look without all the layers? How does it feel? Is it actually worse, or were you maintaining problems by using too much? Many people discover that their skin is happier, healthier, and clearer with less. After this reset period, evaluate whether you need to add anything back. Do you have a specific concern that the basics aren't addressing? Then add 1 targeted product. Use it consistently for at least 4 weeks before evaluating its effectiveness. If it works and your skin tolerates it well, keep it. If not, remove it and try something else if needed, but 1 at a time, always. This methodical approach builds a routine that's truly customized to your needs, not just an accumulation of products you thought you should be using. Now let's address some common concerns about minimalism. Some people worry that using fewer products means they're not trying hard enough or caring enough about their skin. But effort and care aren't measured in the number of products you use. They're measured in the thoughtfulness of your choices and the consistency of your actions. A simple routine maintained daily is far more caring than an elaborate routine performed sporadically. Others worry that minimalism means giving up on addressing skin concerns, but targeted, consistent use of 1 or 2 effective products will give you better results than scattered use of many. Quality and consistency beat quantity every time. Some people feel pressure from the beauty industry and social media to use more products. Influencers showcase bathroom cabinets full of skincare. Brands constantly release new must-have items. Friends discuss their elaborate routines. It can feel like you're missing out or doing something wrong by keeping things simple. But remember, the beauty industry profits from you believing you need more. Their goal is to sell products, not necessarily to give you the healthiest skin. Your goal should be healthy, comfortable skin that you maintain with ease and that rarely requires the extensive routines they promote. Let's talk about what minimalism means for specific skin concerns. If you have acne, minimalism doesn't mean doing nothing. It means using a gentle cleanser, a lightweight moisturizer, one targeted acne treatment, and sunscreen. 4 products used consistently will serve you better than 10 products used haphazardly. If you're concerned about aging, minimalism might mean adding a retinol serum and an antioxidant to your basic routine. These proven ingredients used consistently with proper sun protection are more effective than a dozen anti-aging products used sporadically. If you have sensitive skin, minimalism is especially beneficial. Fewer products mean fewer potential irritants. Gentle basics that your skin tolerates well will always serve you better than a medicine cabinet full of products that make your skin reactive. Minimalism also means being selective about occasional treatments. Instead of using sheet masks every day, perhaps you use one weekly as a special treat. Instead of exfoliating daily with